Good afternoon. I'm Brent Roussin, Manitoba's Chief Provincial Public Health Officer. Current 5-day test positivity rate is 1.25%. There are 40 new cases of COVID-19 that have been identified as of 9:30 a.m. This brings our total number of lab-confirmed positive and probable positive cases in Manitoba to 643. 9 current hospitalizations, including 3 individuals in intensive care, 246 active cases, and 389 individuals have been listed as recovered. The number of deaths due to COVID-19 remains at 8. Our preliminary testing numbers show 2,288 lab tests were completed Sunday, bringing our total to 110,492. Again, we're asking Manitobans to present for testing only if you've had symptoms or have been directed to be tested by a healthcare provider. Testing in those without symptoms is generally less sensitive and places more of a burden on our system. So if you have symptoms of COVID-19, even if they're mild, do attend for testing. Also remember to stay home if you're ill. But if you haven't been directed for testing and you have no symptoms, we're asking not to present for testing. To facilitate that testing, do bring your Manitoba health card with you. If you're visiting from outside a province, please bring your health card from where you reside. Preliminary information for the numbers today. That the majority of the Prairie Mountain Health cases are contacts turned cases. There are now 39 cases linked to a business in Brandon. We have ongoing investigations, so I can't update the total cluster numbers at this point. But as we've been saying, there continues to be early indication of community spread in the Brandon area as well. The WRHA cases, many again appear to be travel related or those of a close contact now turned case, but there is some evidence of community spread as well. All these cases are self-isolating. Contact tracing is well underway. We're advising of 2 potential exposures to COVID-19 that may have occurred. The first was August 7th at the Sobeys, 1570 18th Street in Brandon, and August 10th at the Minnedosa Hospital, 334 1st Street. The Sobeys potential exposure took place from 10 a.m. to 12 p.m. Another potential exposure is on August 9th at the Cartwright Town and Country Golf Club along Highway number 3 just west of Cartwright. So risk of transmission is considered to be low, but providing this information to Manitobans to ensure they're watching closely for symptoms and seek testing should they develop. So again, these potential exposures are another reminder that we should self-isolate as soon as symptoms develop, to stay home even with mild symptoms. And when we talk about self-isolation and staying at home, it's really self-isolating from anyone in your home that's included. All those that are self-isolating really need to do what they can to limit prolonged close contact with others. That includes household members that aren't also self-isolating. We're advising people to go for testing as soon as symptoms develop. We know that a number of our cases have gone for testing, but have done so after many, many days of symptoms, coming back positive, and then our contact investigation is delayed, often finding people who are already symptomatic. So the earlier the testing, when symptoms are present, the better. Again, regarding the asymptomatic testing, we hear many employers are sending employees that have no symptoms to get tested before they can return to work. We're really discouraging that. We really want people with symptoms to be tested. The asymptomatic testing, remember, has a very low utility except for very specific circumstances. So we're asking that only symptomatic people be tested, or those who have been referred by a healthcare practitioner. So we've seen this growth in cases. We know that many of them are linked to other cases or to clusters, but we are seeing some evidence of community-based transmission at this point. But again, we know what we need to do. We've done it before. We've have been doing it all along, but we need to be reminded about those fundamentals. And we've seen that over the last month or so, the average number of contacts per case has increased. We've seen cases earlier in this month that have had 25 plus contacts. So these are indications that we're starting to lose track of our fundamentals, that each case is having a bit more contacts than they did before. So it's a good reminder that we have to get back to those fundamentals, and we're well versed in what those are. Staying home when you're ill, even mild symptoms. Practice good hand hygiene. Do not share items with others, and practice physical distancing when you're outside of your household. That's that 2-meter separation. So this is vital going forward, and we've never really been away from that, but we need to be reminded of that. And in addition to that, in addition to those fundamentals, wearing a mask. So we've talked about wearing masks when physical distancing can't be assured, and most definitely that's important. But what we're saying is, wear that mask in indoor public places when you're not sure physical distancing can be assured. So when we're out and about doing many errands and retail outlets, other indoor public places where you're not absolutely sure that you're going to be able to physically distance, wear a mask. So I think Manitobans should all be ensuring they have access to masks if they can. And I think it's going to be moving forward that we need to stick to the fundamentals. This is not a replacement to those fundamentals, but more and more in those indoor public places when we can't be sure we can physically distance, let's put a mask on. We want to talk again about stigma. And again, played far too big of a role in our response to date. And so reminding Manitobans to be kind. We truly are in this together. And stigma, shame, these are not going to help in any way. They hinder our ability to tackle this problem. So please do whatever you can to limit any stigma or shame that's experienced in this outbreak. We're in it together. Let's be kind to each other, and we can get through this together. So visit our website, manitoba.ca/COVID-19 for up-to-date information, and I can open up for some questions.
Thank you, Doctor. We go to the phone first today from CTV Winnipeg. Mike.
Hi, Dr. Roussin. So we're seeing 40 cases today, one of the largest spikes. Of our total cases, about a third are currently active. So is the government willing to reimpose restrictions to limit the community spread that we're basically seeing, the uptick in cases we're seeing throughout the province?
Well, that certainly has never been off the table. Right, we implemented those restrictions when we needed to. We attacked it by the least restrictive means. So as we saw improvement in our transmission, we loosened those restrictions. Now we're seeing increased transmission again. Albeit a lot of it is related to clusters and known cases, which is important. But what we want to do in our approach moving forward is living with this virus. We know what we can do. We don't need to put these restrictions on if we can stick to those fundamentals. If we can stick to those fundamentals, wear masks when appropriate, then those restrictions really aren't going to be required. But they're certainly on the table, and we're going to do what we need to protect the health of Manitobans. But we're getting that message out that we've done it before. we can stick to those fundamentals and we won't need to have as stringent of restrictions on.
And then going to those fundamentals, when you talked about wearing a mask and how important it is, will the government make masks mandatory, let's say, for inside businesses or inside public spaces? Is that something that's being considered?
So just like any of our restrictions, nothing's off the table. But any anything like this, like mandating things, we want to ensure that it's necessary. So we're increasing our recommendations to this. Manitobans have been great at following public health advice, and we don't expect anything different this time. And so we're going to expect to see increased mask use while sticking to those fundamentals. But we'll keep close watch on our numbers. We'll keep close watch on adherence. And if there is a need to mandate, then we certainly can.
From Global, Marnie.
Good afternoon, Dr. Roussin, Marnie from Global. Just kind of adding on to the last question about masks. You said wear a mask if you're not sure if physical distancing is possible. Given that, especially among young school children, physical distancing can be a challenge, why not then look at mandating masks in schools instead of recommending?
Yeah, and so we start off with the recommendation. We'll do whatever it takes to protect the health of Manitobans, but a strong recommendation for that, and we expect people to follow that. Mandating, if is necessary, if we can't get the compliance that we need, then certainly mandating is something that can be considered. So right now, we haven't seen that it's not going to be adhered to. We haven't gotten back yet, but it's a strong recommendation, and certainly mandating can be on the table.
Thank you. And we're also hearing about a COVID case that forced the closure of a restaurant on Keniston Boulevard. Moxie, are you able to confirm that? And can you kind of talk about what some of the concerns are with restaurant staff member testing positive? I mean, they're handling food and going to different tables and interacting with different people. What are some of the concerns there?
Mm-hmm. Yeah, so I don't have specific details on there. I don't think that was advice from public health necessarily to shut down, but I think that it's anywhere where we are right now is that those fundamentals. The more people we come in contact with, the more careful we have to be about being at work or school if symptomatic, and certainly a lot of our cases are employed. And when we do our public health investigation, they weren't there during the period of infectivity, so public health doesn't often announce it. I can't speak specifically in this scenario, but things like hand hygiene, ensuring you're not present when symptoms are present. And then that physical distancing for the most part, right? Brief interactions, but physical distancing, no prolonged close contact, and we're going to dramatically decrease the likelihood of transmission.
From the Brandon Sun, Bud.
Yes, Bud Roberts, Brandon Sun. Dr. Roussin, I was asked earlier and answered somewhat regarding tightening the restrictions, but with such a huge number in Brandon, would it not be prudent to give consideration to tightening restrictions here first because there are so many cases?
We look at things like that based on our epidemiology. We've talked about our our strategy moving forward, that we're going to try to take much more targeted approaches to restrictions if they're required, a targeted approach to messaging, and so this could be an instance where we do look at things like that, where we don't have any imminent plans to impose those restrictions in that area, but we are certainly making it known that there's significant cases in Brandon, albeit a lot of them located in a cluster or known cases, but we have to ensure those fundamentals are being practiced. When we're seeing cases out in the community, then you have to rethink gatherings. So the orders are in place as a as a guide. But when you're seeing increased transmission, you need to start thinking about your gathering sizes. Ensure ill people aren't showing up. Ensure those fundamentals are being followed, and then. We were strongly recommended those masks in those situations where you can't physically distance. So people need to be aware that there are increased cases and adjust their actions accordingly.
And my last question then, regarding testing, there has been, as you know, some almost panic testing, people going to one location, having to open up another one. Is there a worry that you will not have sufficient testing for them, equipment for them, and staffing?
Well, I think that whenever we see the demand go up so quickly, then we're going to have a bit of a lag, and we've seen that with some wait times for it. As of now, we have sufficient lab capacity for this, but we know there's worldwide demand on the testing reagents and factors like this. So we certainly want to be testing appropriately. But you can see that this yesterday was our highest testing number to date. So Manitobans are paying attention. We want those numbers to be, made up predominantly of symptomatic people. But just like any other resource anywhere, it's always finite.
From CJOB, Diana.
Good afternoon, Diana from 680 CJOB. Dr. Roussin, why not allow individual school divisions to mandate masks rather than setting out the provincial rules? I can certainly imagine in some areas, maybe say Brandon, there might be certain concerns there. Why make it a provincial blanket rather than letting school divisions decide?
Well, I think that as far as the school divisions go, is that we want to be able to provide public health advice for the province, so that we're not seeing different ways of implementation or major differences between divisions. Now, public health advice could certainly be more specific in certain areas. We don't have examples of that at this time, but public health could provide such advice to different regions, which might have impact on that area. But for overall, I believe that the goal is to have a provincial-wide guidelines for school, and then ensure that the divisions who know their situation best can implement those, based on their knowledge.
And then as a follow-up, we're hearing about a restaurant in Winnipeg that's requiring people from outside of Manitoba, or if they're from Brandon as well, to actually show a negative COVID-19 test result before they'll let them in and serve them. What do you make of that? What's your response to that? Is that something that's reasonable?
Yeah, so we discourage that because remember a negative COVID test in an asymptomatic person has very low value. A negative COVID test that I received the result of today means that 2 to 3 days ago I was negative. It doesn't necessarily mean I'm negative today if I'm asymptomatic. So it's does not have much utility to do that. So I'd really discourage that. What I would suggest is the fundamentals. Screening, ensuring that no patrons are symptomatic, that no patrons should be self-isolating under current orders, hand sanitation, and physical distancing. Those are much more important.
From the Winnipeg Sun, Scott.
Good afternoon, Dr. Roussin. Question. So on July 14th, there were 330 cases in the last month. That number's essentially, it hasn't doubled, but there's been 313 in the last month and 330 in the first 4 months. The highest number of active cases. And the message has been the whole time to, get back to the fundamentals and that sort of thing. But when we got back, when we were doing the fundamentals back in March and April, there were restrictions in place. I guess my question is why do we think, or why do you think that this getting back to the fundamentals alone will stop the spread when we stopped the spread, it was because of the restrictions in place plus the fundamentals?
Yeah, and just like everything with this pandemic, we've learned a lot. And so we know that those restrictions had major impacts, one on flattening the curve, but also other impacts on health and the economy, which are significant. And so those are certainly at our disposal. But we want to limit the need for widespread restrictions like we did in the past. If we can get people to follow the fundamentals, we're going to dramatically decrease the chances of sustained community-based transmission. And then the knowledge that this isn't just for another month or two, right? This virus is another year or two, at least. So we can't continually rely on massive shutdowns to get through this because it's not just a way to get through the summer, or it's not just a way to get through the fall. We're going to have to deal with this virus for quite some time, so we need to find ways to do that without massive shutdowns.
Okay, and follow up to that, you talked about community spread right now. Where is that number at compared to where it would have been early on in the pandemic when we were at our former, I guess, height of cases and active cases and all that?
So as far as a percentage of cases, it's still about the same. About that 11 to 12% of cases would be of unknown acquisition, which we would define as community-based transmission. So we still see that. In the last 7 days, we list right now 31 as non-epi-linked cases. Again, that's an overestimate because it's just cases that haven't yet been linked. But as far as the proportion of cases go, it's about in keeping with where we were earlier on in the pandemic.
From CBC Radio Canada, Gavin.
Hi, Dr. Roussin. You mentioned that you were seeing cases with 25 plus contacts. How does that compare to, say, in April and then to, say, in July? What has the increase in contacts been like?
Yeah, and so if we look at, say, the Winnipeg region, it may not seem that significant, but our average number of contacts in the past were about 3. That has jumped up to 4 now. And so that is significant on a broad number, and then we mentioned that there was a couple cases with 25 plus contacts. So during the period of massive restrictions, there just wasn't much opportunity to expose 25 people. And so now we see that in just a couple cases. But it's important because we know that in Manitoba, our numbers suggest that about 14% of close contacts go on to develop COVID. And so it's all about the numbers here. And so all of this goes into limiting that secondary transmission. An individual may come down with COVID, but if they had been physically distancing, if they haven't been at large events, then that secondary transmission is going to be much lower. And so that's what those fundamentals are all based on.
We're looking at the cases today. There's 6 among people who are less than 19 years old. In the last week, we've seen a few cases in kids. Are you noticing an increase in the amount of children that are getting this virus, and what might that mean for the school year?
So the acquisition here, it's not necessarily an increase, certainly not in prorated to the number of cases we've been seeing. We know that those under 18 make up a smaller proportion of cases. Many of the very young kids that we see there are household contacts. And so that's where we're getting those from. So again, we're not seeing a lot of evidence of transmission from the young kids. Certainly, the younger kids can acquire, and then of course we don't see as many severe outcomes in those younger kids either.
From the Canadian Press, Kelly.
Hello, Kelly Malone, Canadian Press. So you said today that 39 cases are linked to the Brandon business, the Maple Leaf plant. Are you still saying that there is no workplace transmission? And if so, can you give any indication for such large numbers?
Yeah, well, the issue is that there's a large cluster in the community that many of the people that work at that facility are in. And so that's why we see, when we're seeing these clusters, which is in the high 60s yesterday, within a group of individuals that many of which happen to work at that site. And so to date, we don't have that evidence of workplace transmission. It is something that we're looking at very closely. And as you say, the increasing in numbers that we see that happen to work there, then certainly it requires us to pay as close attention as we can to that. But we're getting people isolated, doing thorough contact investigations, and whether that includes anyone at the workplace or outside, those people are going to be self-isolated. I know that the company themselves has been self-isolating even greater numbers of individuals than public health has identified as contacts. So a lot of work is being done, and a lot of testing and a lot of isolation is taking place. So we're going to keep working on that. We have multi-agencies involved in that. The company's been very cooperative and going above and beyond. So we'll just keep working on that and keep looking for any of that evidence of interfacility transmission.
And we're seeing a lot of indicators this week that would probably be concerning for statistics. Today ties the record to the most new cases reported in a single day, an significant increase in positivity rates, and you're saying that there's indication of community transmission. What do you need to see for the government to take steps to mandate that people are following these fundamentals? Or is there a plan to educate people differently so that they take these fundamentals seriously?
Well, as far as the taking the fundamentals seriously, that's what we're trying to do right now. We are looking at in the upcoming week or so, trying to get some more detailed information about to Manitobans about risk levels, especially in certain areas or certain sectors, and that's something that we'll work on, and it will be a great value to Manitobans as well. But we really see that these cases, and as you said, we've seen an increase in case numbers come, and as I mentioned, we're seeing increasing in the average number of contacts per case, and so it's some evidence that we've lost some sight of our fundamentals. We've gone through a challenging time everywhere, and having a beautiful summer, and people are really feeling the need to get out and about, and sometimes that might mean that we lose track of those fundamentals. These cases should be a reminder that this virus is still here, that we're not done with this. So we need to still be safe, still practice those fundamentals, and we want to be able to do that without having very strict restrictions in place. We want it to be done by everyone knowing their risk, everyone doing their part to reduce the risk for them and to others. But certainly, if the numbers continue to climb, if we see increasing demands on our healthcare system, then certainly more stringent restrictions could be on the table.
Thank you, Doctor. We now go to the news conference theater. Please proceed.
Roussin, Ian Frey, CBC. Just to follow up on that last question, you said you'll have more detailed information about risk levels. You've already provided more granular information about where cases are. What could be next?
Yeah, and so what I'd say is just we're going to provide more details about that in the upcoming weeks, and so we'll I'll ask us to to wait until we can provide that to Manitobans.
You mentioned the average number of cases or contacts in Winnipeg has gone from 3 to 4. What are we looking at elsewhere in the province?
Yeah, I don't have those numbers broken down. I've got those ones, those preliminary numbers from Winnipeg, but that's certainly the trend everywhere is that we're seeing increased number of contacts per case.
Could it be higher in Brandon?
It's possible.
Yeah. In terms of, we were talking just about youth and children earlier. You say most of that is household contacts, but is there any evidence of children getting this virus through community spread, say daycares, etc.?
I'm not aware of those issues. The younger children that I'm aware of are household contacts of confirmed cases.
Dr. Roussin, do you know if Martine Bouchard, the CEO of St. Boniface Hospital, has an exemption for self-isolating?
So no individual or institution gets an exemption for themselves. The travel orders have exemptions in them, and there's no ability within the order to provide additional exemptions. So people either fall within the exemptions that are provided or they don't.
And what do you think of the example that sets when the CEO of a hospital during a pandemic violates a self-isolation?
Well, I mean, the exemption order allows for critical care, critical infrastructure work, as well as healthcare providers as an exemption. So I wouldn't use the term violate on that. As far as the we need to know what kind of precautions were taken, and there might have been many. I don't have details on that. And again, my message is be kind. This type of we want people to act responsibly, everyone, but shame or anything, I guess, is not going to help our response to the pandemic. So my advice is that the people take those precautions, whether they're exempted from the travel order or not. They need to take extra cautions, especially if you're traveling to a more endemic area, such as out east. Just because you're exempted doesn't mean you should not take any precautions while you're there or when you return. You're just exempted from a mandatory self-isolation.
And so far you've talked about, stigma is our enemy and shaming is not going to help in the fight against COVID. But if people are flouting the guidance, flouting the laws, some people are getting fined, like the restaurant on Corden. Some other people are not. There doesn't seem to be any enforcement. So instead of, increasing restrictions on everybody, isn't this maybe time to use more stick and less carrot on the people who are violating?
Well, I think it's a reasonable question. I think that we do enforce things, and there's certainly that ability to do so. But it's a balance, So when we talk about, when we announce these locations of where there might have been an exposure, the only way we know that is because they told us. We can't possibly know that any other way. So the more it's out that we find somebody who is a case, or we did some sort of coercive measures on people, it might be that the less likely they are to start telling us about these things, the less likely they are about telling us the gathering they attended. So I mean, I think it's a fair point, and it's a balance. So we do enforce things, and we will continue to. Where that balance is sometimes difficult to know.
And what about fairness? So some people might think, well, it's fair to find a small business, but but it's not fair to find somebody who's the head of a health corporation like a hospital? Well,
I mean, if somebody violated something and put Manitobans at risk, then that's certainly an option. But that's really not the case in this specific example. But again, there really isn't any business that's been fined that hasn't been repeatedly warned, educated, and provided advice on how they could comply. So it's not our method to just enforce things in a coercive manner. We educate, we help people comply, and if we find that there is that disregard for advice for the health of Manitobans, then sometimes we're not left with anything else but to fine.
One of the biggest clusters is in Springfield, 28 active cases. Can you speak to what happened in that case?
Are you referring to the health district?
Yes.
Yeah. So, I mean, there's not a whole bunch of detail I can give. When we start breaking down these districts, then there's going to be certain ones that light up for various reasons. I could say that based on our information, we don't have anything to disclose to the public that they need to be specifically aware of that we haven't in the past.
Dr. Tam today presenting new modeling, talking about hoping for a bit of a slow burn, but there's a worst case scenario of a fall peak, and we could see peaks and valleys after that. What are you looking at for the fall in this province?
Yeah, and so when we have our preparation and our plans for a pandemic response, really, our number one goal is to reduce severe outcomes, right? Significant morbidity or mortality, which includes the stress on the healthcare system, and then quite closely related to that is to reduce societal disruptions. And so those are the major goals. So, our goal can't really be to not see any cases of COVID-19, right? We're in a pandemic. And so we report the numbers of cases here. We're trying to report more on things like the test positivity rate, but we have to expect to see cases of COVID-19. And so during a pandemic, our goal can't be to somehow eradicate the virus from just our jurisdiction. Our goal is to minimize severe outcomes, so hospital admissions, ICU admissions, deaths. Over time, we're going to continue to see this virus. We're going to see periods of peaks and valleys. But we need to be able to find ways to deal with that without massive shutdowns every time we start seeing cases again.
Do you see this as a peak?
Well, this is certainly a peak. We went some time without any. Any cases. And then I'll just, clarify, I'm not saying that necessarily we are at the peak right now, but certainly we're in an upward trend. Where this scenario will peak will be determined later, but certainly we've seen this increase in cases, and it's linked to a number of clusters, including this one in Brandon.
I guess the worry is that we're going to continue to see this, right? 20 cases, 30 cases a day. Like, is there an expectation that this could be happening all fall long?
Well, this is the big impact of public health, right? So when we find these cases, we get these 40 cases reported yesterday, then public health immediately is contacting these cases to ensure they're self-isolating. If they're symptomatic, they should already be, because our message is to be at home when you're ill. Finding those contacts, getting them all to self-isolate, and many of them will turn into cases, but they've been self-isolating. They haven't been exposing anyone else. And so with that starts bringing down that R number. And so we will start seeing those numbers go down. And so, it's hard to know what to expect, but we have to expect to see cases.
Last couple of questions, guys.
The unknown districts. In Winnipeg yesterday, we heard the Winnipeg Health Region had 34 cases. Winnipeg District had 32. 2 were unknown. The 2 unknown, under what circumstances would those?
Yeah, so just as we the district where we place you in the district has to deal with the information about a postal code, and so sometimes that information just isn't available right away. So we just have to classify them as unknown. And so we're going to expect that some cases we just can't put into a district right away.
Like when people just...
Yeah, I don't know the exact details on these ones, but it's just each postal code and a number of postal codes will make up a district. When we get the lab rec at surveillance, they can plug in almost all of them right away into a district based on that. Sometimes they'll have to dig further, so there'll be an unknown district.
Because Winnipeg's got 2 districts, Winnipeg and Churchill. Right. But these aren't Churchill cases.
No, Churchill is a district. So in Winnipeg. So
2 cases might be in Churchill?
Well, no, we don't have any cases in the north right now. So.
But Churchill's not considered part of north.
No, Churchill have their own district like part of Winnipeg. Yeah. So if we had a case in Churchill, it wouldn't be an unknown district. It would be in that district.
Okay.
Yeah.
You mentioned that we're losing track of the fundamentals, but you don't want to penalize or fine people. You don't want to shut down the economy again. So what can you do to get this message across?
Well, I think we've losing track of it is the right term. We haven't forgotten it, and Manitobans have stepped up before. And again, we stepped up before with, it was early on, so we had some significant help to step up because of the significant restrictions. But I think Manitobans are well aware of the risk. We've seen these numbers. A lot of them are related to cohorts, to clusters. And this is that reminder that we have to get back to those fundamentals. We can put restrictions on again if required, but we really want to be able to get through this without having to continually put on restrictions and lift and put on and lift, because it's very likely we will see ongoing cases, possibly peaks and valleys. So we need to be able to get used to seeing cases, but we need to be able to deal with that without stringent restrictions each and every time.
Would it be at all helpful if there was more enforcement of the Quarantine Act by the police and the RCMP, or the self-isolation guidance or guidelines in the public health orders? Would that help if there was more enforcement?
Well, I don't know if we can link a lot of what we see to things that would be improved by that. We know, certainly travel, but most of the cases that are related to travel have been self-isolating. So they don't have a severe numbers of cases or contacts. But yeah, I think enforcement has always been part of the plan. It's just not the most important thing. The most important thing is that to get people on board, to know we all have a role to play, and know that certainly enforcement is an option.
I just want to clarify one thing you said. You said when we're seeing increased cases, we have to rethink gatherings. Are you saying that's on an individual level for Manitobans, or are you saying it could be the gathering limits that public health doesn't put in place?
Well, the first, definitely right now, that at the individual level, we have our restrictions that are in the order. But is now the time you want to be getting together with 30 people when you can't physically distance? Certainly within the order, you're allowed to do that. But when we see increasing cases, is this the time that you want to do that? Perhaps think about that. Certainly we can adjust the orders to limit that at some point if it was necessary, but we really want Manitobans to start making their informed choices. If you're seeing a lot of spread within your community, then maybe you have to rethink some of the things you had planned.
Thanks, guys.